It's 8 a.m. from Fox 35. This is Good Day Orlando.
I'm glad that I'm freezing my eggs. I think now I could just be proactive. I want to make sure when the time is right, I want to be prepared. I should be safe.
Well, you've heard Kim Kardashian say that she's doing it, freezing her eggs, and so are a lot of young women. Freezing their eggs, very popular right now, a way for them to turn back their so-called biological clock as they age. But this morning, health officials are still urging some caution. The American Society for Reproductive Medicine says more younger women are freezing their eggs so they can get pregnant later in life. But doctors say not everyone is a good candidate for childbearing later in life. And joining us this morning on Good Day to talk about that, fertility doctor, Dr. Mark Trolice. Always good to see you. Thanks for coming in this morning.
My pleasure, Amy, as always.
So when you first heard this, what were your initial thoughts when they were saying, this isn't a good idea for everybody?
Well, we've been able to freeze eggs for a while. The first pregnancy from frozen eggs was 1986.
Wow.
But now new technology over the last 10 years has allowed for a rapid freezing that is less risky to the egg, so we're able to have the egg freeze and survive much better. So I thought it was, we've been doing it for several years now, and I think it's a great opportunity for women, particularly the women that are going to be facing cancer. The medication that they get for cancer can accelerate the loss of eggs and even put them into ovarian failure. So this is really a great way to preserve their fertility. I think the controversy comes about when you're doing it for elective reasons, but you know, we talked earlier, I don't think it's really a controversy. This is empowering women with options. And if they're not at a point in their life where they're prepared to have a child financially or relationship-wise or career-wise, then this is some insurance for them to be able to potentially have children later.
How invasive of a procedure is this, and how expensive is it on average?
Egg freezing is no different from the in vitro fertilization cycles that we've been doing for years. Okay. It involves a woman being on stimulating fertility medication for about 8 to 10 days. Then in the office, and I just did one earlier this morning, we do under sedation. A needle under ultrasound guidance goes through the vagina into the ovary and vacuums out the eggs. Extremely safe, very, very rare risk of any type of complication. And the cost, I think in general, is somewhere in the I would probably say around $8,000 to $10,000, around there. I think the two caveats, though, that all women should realize is, number one, there's no guarantee. You can freeze the eggs, and then when you're ready to have a child, it may not be successful.
Right.
It is age-related. And the second is that cost-wise as well.
Right.
But there is an age limit. I think when you start getting into the above 38, you're starting to see a significant decline in the success of using frozen eggs.
All right, Dr. Mark Trolice, great advice. Thank you so much. We appreciate you coming in this morning. Always good to see you.
My pleasure, Amy.
Let's send it back into John.